If you own a business with under 50 employees in America today, there's a legal loophole that you can use that will literally wipe out premiums for your employees, the spouses, and their kids, and you can become a magnet for top talent without spending one dime more than you're spending right now. If that's you, you're in the right place. There's an extremely disturbing fact in America that 66% of American bankruptcies are healthcare related, and 75% of those people had health insurance in this country. I want to test what you know about what caused all this. True or false? The normal broker distribution channel is connected to insurance companies and contracted to serve their interest, not yours. That is true. You see, brokers receive commissions from insurance contracts when they sell you an employer group plan. The commissions that they receive on group health commissions when the employer owns the contract are usually between $20 and $40 per employee per month. For a company of just 40 employees, pencils out to about $14,000 annually at $30 per employee per month. That's what a typical broker earns. Now, how about individual health commissions? What do brokers receive on individual health insurance commissions? Well, the fact is, it's between $0 and $10 per employee per month, not $30. And actually, the majority of the commissions between 0 and 10 are at $0. So brokers don't receive commissions of any kind sometimes for selling individual health insurance. If you were a broker, what would you sell? True or false? As a responsible employer, you must purchase a group health insurance plan to provide compliance benefits to your employees. The answer to that is false. This is a myth. Group health plans are only one way to provide compliant employee health benefits. The truth of the matter is that there was a law passed over 6 years ago that allows employees to own their own coverage and employers to legally reimburse these employees through their payroll deductions tax-free. No group contract required, completely compliant. True or false? Individual health insurance plans are more expensive and offer deficient coverage compared to employer group plans. That one is definitely false. The actual unvarnished truth is that individual insurance can be purchased at between 40 to 80% less cost than equivalent group coverage. You see, there are marketplace exchanges set up in all 50 states nationwide, and these have been set up since 2014. Individual insurance can be purchased at either retail prices or through these exchanges at discount prices. This has been true for over 12 years now, but that fact that health insurance companies pay little to no commissions to brokers who sell these type of policies is not well known. The other fact, which is an alarming fact, is the highest margin products for health insurance companies by far are employer-owned group insurance contracts. But how does this work that it could be 40 to 80% less expensive on individual plans? Pro tip number 1, and likely the most important slide that you will see in this entire presentation. In 2026, individual health insurance costs are capped at just under 10% of household incomes. And who's eligible for these discounts? If you're a single person earning $60,240 or less, you're eligible for that discount. If you're a family earning $124,800 or less, you're eligible for these discounts. And these discounts are substantial. And let me give you an example. If you have a single person that's 60 years old on your group plan right now, that person is likely costing you somewhere between $900 to $1,200 a month, depending upon which plan you have. But let's just say you have a Blue Cross Blue Shield plan with a $3,000 deductible. At Revival Health, when we allow that person to own their own individual plan, they can buy that same Blue Cross Blue Shield plan that you're offering on the group for a premium rate of $415 a month, because that's 10% of this income right here. And as the person gets older, if the income stays the same, it stays at $415 a month. That's how this can be done through Revival Health at 40 to 80% of the discounts that I'm talking about. Now, a family is the most dramatic one that's impacted of all. A lot of families in America earning $100,000, right? Well, 10% of $100,000 on a family of 4 is $830 for the husband, wife, and 2 kids. The entire premium is $830. Now, the the average family premium around America right now is over $2,000 a month. But the portion at the bottom is the most impactful part in this slide. And most companies don't know this. But if you own an employer-owned health plan, and I don't care what kind of a plan you own, I told you before about fully insured plans. That's what the health insurance companies want you to buy. Maybe you have a self-funded plan. Maybe you have a level-funded plan. And maybe those terminologies don't even make any sense to you. What I want to get across to you is if you still own the insurance contract, you lock out all of your employees from receiving these discounts that I've just shown you on the screen. And that's how Revival Health is formed, and that's how we impact employees and families of any company under 50 in size. True or false? Employees must answer medical questions and pass underwriting to get individual health coverage. That answer is false. Under the Affordable Care Act or Obamacare, the law states that any health insurance company is prohibited from asking any medical questions whatsoever. That's the law. Pre-existing conditions covered. The same basic protection as group plans without the group plan price tag. True or false? Switching away from a traditional group health plan means firing your broker and disrupting your entire benefits at your company. That is most definitely false. You can keep your broker relationship if you want. Many businesses maintain their broker for advice while shifting health insurance to a direct purchase model. That's Revival Health. You see, this isn't about eliminating relationships. It's about eliminating the system, the status quo system that's crushing businesses across this country. We want to replace it with a sensible system, one that benefits both you and your employees rather than the insurance companies. And brokers can be compensated under our Revival Health program. True or false? There's a proven ACA compliant model that allows small businesses a guaranteed flat budget with no annual renewal premium increases or surprises, while at the same time improving employee satisfaction. As crazy as that sounds, that is very true with our Revival Health plan. Flat budgets and no renewal surprises is a thing of the past. Employee choice. They have real ownership of the coverage, 40 to 80% savings under federal law, and it's 100% compliant from the IRS, DOL, and the ACA standards. This is exactly what we built with Revival Health. So just a quick recap. Health insurance companies' highest margin products are fully insured, employer-owned group insurance plans. You don't need to own a group insurance health contract to be compliant. Individual plans can be cheaper and better, as I'll show you in a bit, with even more choices for your employees. No medical questions are required for employees to apply. And there is a proven alternative that finally provides a flat budget for employers. Because you see, when you disconnect from the contract of owning the insurance, your employees' claims are paid by the insurance companies separate from your business, aren't they? So you literally can set a budget and stay with that budget. This traditional system is designed to keep you in the dark, and we're changing that today. I have two agendas. Give you the clearest, most actionable understanding of business healthcare completely free. And the second part is to present an invitation to work together through our Revival Health Discovery Session. My commitment to you. If I don't deliver genuine clarity and value in the next 60 minutes, I don't even want you to consider the discovery session. I want you to judge this by what you learn. If this doesn't fundamentally shift how you see business healthcare, I really haven't earned the right to invite you any further. Here's what's coming. Why it's broken: because of these outdated systems and misaligned incentives, a big lie that cost cutting is impossible without cutting benefits, and a step-by-step practical roadmap for your business with under 50 full-time employees. Stick with me. I've got something special for you to take action. But you see, I've been in this business for 28 years. I know where you are. You're in an annual cycle. Your plan renews every year. You don't know what the bad news is. Do you have to pay more now? Do you have to cut coverage? Your employees are frustrated. They probably already have high deductibles, maybe shrinking networks. They complain, why do we even have insurance anyway? I don't know how many times I've heard that over my career. And you lose focus. Too much time managing health benefits at the end of the year. You usually spend 2 or 3 months trying to figure this out rather than running your business. But that frustration is real. You're not alone. You've probably tried shopping around, maybe even switched brokers once or twice, but nothing really changes. Costs keep climbing, coverage keeps shrinking, and you wonder, is there really any way out of this mess? It's really not your fault. The problem isn't you. The problem is the system that was never designed with you or your employees' interests in mind. Shopping around just means choosing between different versions of the same trap. You're very, very wise to be skeptical of this. You see, I spent 32 years inside this system. I built and ran a successful brokerage firm for 28 years during that time. I played the game the same way the health insurance companies said I had to. And I watched good businesses, good families get crushed by the higher costs and the decreasing benefits every single year. The real breaking point for me was to find out about the healthcare bankruptcies I mentioned at the beginning. How could 75% of these people have health insurance and still go bankrupt? Well, what happened was I realized I was simply part of that system and was failing the very people I was supposed to be helping. So I needed to make a decision. I sold my brokerage firm in 2023 and walked away from the commissions and the carrier contracts. I left that machine. My industry colleagues thought I was crazy, so I started over. 6 years ago, I started building something that actually serves businesses and their employees and not the health insurance companies that are killing all of us. What I discovered when I stepped outside of this system is that there are legal pathways that exist already within the frameworks of the Obamacare bill that support a completely different model. And nobody would tell you this because the health insurance companies don't really pay brokers under this model, as you've already seen. My mission is new now. I want to help business owners across America escape the healthcare trap, save massively on costs, and give your employees the dignity and respect they deserve. When you give your employees choice without the conflicts of interest of the old broken system, things change dramatically. But nobody has ever really truly applied first principle thinking to business healthcare until now. Here's the old way. This probably sounds familiar. You hire a broker. Your broker shows you plans. You pick an option. You sign and renew the contract. And every year, that contract becomes higher priced and more difficult to maintain. You see, the health insurance companies knew, in fact, it started decades ago, that when they lump your employees together and just a few of your employees have bad claims, it impacts all of your other employees, doesn't it? Because they lump you all together. This is designed to benefit the health insurance carriers and the brokers who represent them. Because let me tell you something, if you just allow your employees to own their own insurance, the insurance companies pay those claims independent of your business, don't they? And it can never come back to your business because all you're doing is being a money provider to your employees. And that's the way it should have been from the beginning. Why does the old way continue to fail? Well, there's all kinds of reasons, but there's hidden reasons inside this. That's what's really crazy about this. But let's face it, it's less work for a broker to sell one plan to a company of 40 employees rather than to handle all 40 employees' coverage, isn't it? That's easy enough. But here's the hidden truth. Brokers are offered big bonuses just to have you stay with that Blue Cross Blue Shield contract and avoid the pain of announcing to your employees that they have to switch networks. Oh, is their doctor in the network? Is the hospital there? Is my wife going to be mad? That is pain. But behind the scenes, health insurance companies say to brokers, look, we'll give you an extra $5,000, an extra $10,000 just for renewing that same plan. So there is no financial incentives for your broker to find you savings. In actuality, if they just renew your plan with the same company, less work for you, less work for them, and the broker gets paid. But what if you didn't have to play this game at all? Stop owning the contract. Stop being the middleman. Give employees money to buy their own coverage. It's fully compliant, dramatically lower costs for both you and your employees, and you can get out of this mess. Why this changes everything. You pay a consultant like myself that's aligned with your interests, and we make sure that your costs are lower, that your coverage is better, and your employees choose coverage that fits their needs. You see, there's 5 words that I don't want you to ever forget. People support what they create. Those 5 words are very powerful. When done right with our stellar enrollment team, and they choose their own coverage, they choose their own deductibles, they choose their own prescription drug coverage for themselves and their families, they fight to keep that coverage. Believe me when I tell you this, you're choosing for them right now in your group coverage. You're choosing Blue Cross or Cigna or Aetna or United Healthcare. You're choosing different deductibles. Maybe they can pick, but you're choosing. People support what they create. That is a big thing as far as Revival Health is concerned. And you, the employer, get predictable savings and freedom to focus on your business. This isn't a theory. This is what we've proven works over and over again. The nice thing about Revival Health is it functions just like your group plan. This new system actually works kind of like your old system, but it actually does work. You see, you still pay one premium to our administrator rather than to the health insurance company. Our administrator pays the insurance carriers on behalf of every one of your employees electronically each and every month. And if you do have your employees pay something, there's a payroll deduction file that you get just like your old group plan. Your HR receives the payroll deduction file and they take care of all of your employees' portions on your payroll. Remember, you don't have to change your broker. Revival Health actually has a separate program designed for brokers. So any licensed broker can utilize Revival Health for their own employer clients. You see, we are not in the business of disturbing relationships. We are simply providing a new system, one that actually works. But when you think about this, your broker has never sent you an invoice, has he? And that's because your broker is paid by the insurance company, not by you. Once you understand this, it's hard to look at the system, the old system, the same way again. Switching brokers doesn't escape the system. You're just moving to a different seat on the same sinking ship. Every traditional broker is tied to carrier contracts. Their menu is limited by those contracts, and none of those contracts include pathways that save 40 to 80%. When you don't need to own the contract, providing excellent benefits to your employees is much, much easier. You see, if you own a 40-person company and you're spending $600,000 right now for those 40 people, let's just imagine that you're spending $400,000 and your employees are spending $200,000. When you adopt Revival Health, we take that $600,000 down to $300,000. Now, you used to pay $400,000 before, right? But now we've brought it down to $300,000. If you want to pay the same amount that you did before, you can, and keep that flat at $400,000. But what you can do is take care of all of your employees, the spouses, and the kids' premiums, and you can put $100,000 to your bottom line. Your new budget is now $300,000, not $600,000. And you can do what you want with your employee money, but I'm going to show you a path, if you want to see it, that will wipe out all employees, spouses, and kids' premiums and become a magnet for talent with your company. Now, just knowing this, doesn't it change your mind a little bit about the advice you've been getting? When you're stuck in employer ownership plans, what this actually means is you have enormous risk because your claims go up every single year and you're punished at the end of each year. You're locked into this coverage that's certainly not serving your employees well because they didn't choose. You chose for them. You have one direction with your annual renewals where your collective claims make prices go up every time and you are stuck in the middle. Every question that your employees hands lands with you or your HR and you have to deal with that over and over again. Revival Health changes that system. Like I said, this is an ACA-approved alternative. You exit the old system and install a new system. Employees purchase and own their own individual coverage. You simply reimburse them through payroll. And who wins this time? Your employees get choice, your business gets predictability, and the carriers lose their control over your company. Freedom for your business, freedom for your employees, no more ownership, empower your employees, and frankly, give them the decency and dignity that they deserve by choosing their own coverage, and help them with our Revival Health team. The numbers simply don't lie, folks. When you let the data, not tradition, drive your benefit decision, everything changes. We will show you the numbers. This is simply math. This is not a sales system. If the math works, consider it. If it doesn't, don't. We're not going to pressure you. This is not a sales system. This is a true guidance system. But can you see why no one in the traditional broker world would even mention this as an option? It simply doesn't pay them. How the Revival Health system works. First is the audit spend. We compare what your options are. We see how much you're spending now compared to how much you could be spending, what your coverage would look like before and after. We provide you with a clear roadmap, and if you decide after seeing that roadmap, we deploy your coverage. It takes between 45 and 60 days, and then we optimize this coverage every single year for you and your employees. 40 to 80% less, like I said before, no medical questions, fully compliant, transition timeline within about 60 days. And the timeline is immediate. You get clarity, complete clarity from this audit. Full implementation from start to finish, and the savings are visible. There's no need to wait for your renewal. Every step is designed around your interests, not somebody else's revenue goals. But why listen to me? I spent 32 years inside this business, this industry. I ran my own brokerage firm for 28 of those 32 years. I sold that brokerage firm in 2023 to serve employers and employees around America. I ended up writing a book in 2021 called Health Insurance Sucks: The Moral Case for Better Business Healthcare, because business owners and their employees actually deserve the truth. Now, I want to make this personal for a second. What results do you want? Do you want to have a plan and announce this to your employees at the next big employee meeting that literally wipes out all their premiums? Do you want a plan that also says that we are going to give all of you employees $2,000 each year to help with your deductibles? You can do that. If you want to eliminate all premiums, you can eliminate the premiums for the employee, spouses, and kids. And because you likely will have something left over, you can decide to put $1,000 or $2,000 for every employee into their HSAs, which will help them with their deductibles. In that instance, I've just shown you with the math that you have just wiped out premiums and deductibles for your employees. Can you imagine what that announcement might feel like for one of your employees, one of the families that work for you right now, that are maybe paying $1,200 a month for their family coverage under your Blue Cross employer-owned plan? Can you imagine when you tell them that they have an extra $1,200 a month? What would that do for morale around your company? We need to check these boxes to see. If you checked most of these boxes, you're not alone. Have your premiums increased in the last 3 to 5 years? Do your employees complain about their high deductibles or narrow networks and say, what do we even have insurance for? Have you switched plans or even brokers, hoping for better results and still been disappointed? Do you find yourself spending much more time on benefits each year, guessing how bad your claims are going to be at the end of each year? And are you forced to choose between cost and coverage quality? Bracing every year for next year's renewal with what mystery increase you're going to get. Well, I got news for you. If you check 3 or more of these boxes, you're experiencing exactly what that traditional system is designed to create. This isn't because you haven't tried hard enough. It's because you're operating inside a machine, a system built to extract maximum value from your business and your employees. Now, just imagine if you were on the other side of this and you're coming up to a November and you're thinking, what was my last year like? I didn't know what my increase was going to be, but now I know I've got a flat budget because guess what? There's no more group health insurance renewal. You are dealing with grateful employees thanking you because you lowered their costs. Maybe you didn't decide to eliminate them altogether, but you lowered what was coming out of their paychecks dramatically, and they're grateful for those benefits that you've given them. And most of all, you get your time back. You didn't start your business to have yourself run a mini health insurance company inside your business, did you? That's not why you started your business in the first place, and Revival Health is here to get you on the other side of that. Here's the conflict that nobody really talks about. Brokers earn commissions based on their total book of business or the sum of all clients' premiums. But it doesn't stop there. Those big bonuses, they also get paid from the insurance carriers to make sure you stay with those same plans. The real results that we're bringing with Revival Health are clear. Here's a manufacturing firm that we work with on the East Coast, 35 employees. Before they came to us, they were spending $425,000 a year on their group plan. They were getting a 16% increase from that $425,000. They had employee complaints, and their administrators were getting drained each year, wondering how these claims are going to impact them in the next year. After implementing Revival Health, the first year cost went from $425,000 down to $215,000. We saved them $210,000 right off the top. The employer decided to reduce down the employee premiums by 80%. The employees were thrilled. And now their HR leader simply goes on 5 minutes a month and does the payroll deductions because you're a money provider, and that's it. HR regained 12 hours per month to do her job in a more effective way. There was an 18-employee advertising agency that came to us before. They were spending $210,000 a year. The employees were stuck with plans that didn't fit their needs, and the employer funded about $135,000 of these costs. The employees paid the rest of those costs. After Revival Health, we gave them a 40% reduction. The employees customized their own coverage. The agency decided to eliminate all premiums for singles, spouses, and kids, and their recruitment has soared since that time. There's a consistent pattern here. You've got to recognize this. Budget reduction is essential to take down those costs. When you take those costs down 40 to 80% and use your employer money to be deployed the way you want to use it, that is a huge impact on your plan. But there isn't any more renewals. You have real employee options and less admin hassle. But here's a little tip at the bottom that maybe you haven't considered. Since employees own their own coverage, employers no likely need to worry about COBRA because employees simply keep their coverage if they leave your company. How simple is that? Here's what I'm asking for today. $67 covers the analysis, the audit, the savings projection, and the implementation roadmap. You walk away with everything you need to make an informed decision whether you work with us further or not. There was a realization for me that happened where I knew I had to make a choice. You now know why switching brokers or switching plans never worked, right? You've seen real businesses save $150,000 or more by this past two illustration and reduce their cost by 40 to 80%. All I want to do is to map out your specific numbers. I want to show you your math for your business first. This allows you to compare the cost and coverage and make a truly educated decision. My proof standard, everything I recommend is backed by evidence. ACA compliance, IRS codes, DOL guidance, documented case studies, and real-world results. I don't ask you to take my word for it. I don't ask you to listen to a sales pitch. I just ask you to look at the numbers and decide for yourself. Because whether you realize it or not, these are real numbers, and this is the law. And if you follow those numbers and you follow the law, the math works. And if the math works for you, we simply ask you to consider our Revival Health system. Your next step is a Revival Health Discovery session, a dedicated consultation where we dive into your situation. It's not theory, it's not generic advice, but specific analysis of your business and those opportunities that may be presented for you. A complete audit, a personal savings projection, and a 45 to 60-day execution roadmap where we would map out exactly what it would take if you decide to adopt Revival Health for your business. Once again, this is not a sales call. I've been in sales for 40 years. I'm through selling. This is a genuine diagnostic session. We just look at your numbers together and you ask your questions and you decide whether or not this is a good fit. If Revival Health isn't right for your situation, and I know that it's right, for whatever reason, we'll tell you directly. You see, this business of mine depends on results. We want results for you. We want testimonials from you. We want your employees to be happy. I'm not here to convince people that aren't a good fit for this and waste either your time or mine. What happens next is a simple discovery session. You choose whether or not you want to move forward after that. No pressure whatsoever. My 3 value guarantees are: if the discovery session wasn't worth your time and investment, no questions asked, full $67 refund. You will walk away with a clear understanding of your spend, savings potential, and options, no ambiguity. And we will never, ever pressure you in a salesy way, and we will never waste one moment of your time. Frankly, we don't see value in wasting anybody's time. This just isn't good business, is it? But the cost of waiting, just for a company of 20 employees, the average cost is $12,000 a month. That's $144,000 a year. Not just the first year, folks, but every single year. A 45-minute discovery session is all it takes to start to see if this makes sense. And there isn't any need to wait for your year-end renewal. There's no penalties for coming out of the old system. You may have questions about this, but I've got answers for you. If you decide in April of this year to switch to Revival Health, there are ways of making this whole program work in June going forward. You don't have to wait till the end of the year. Now, if you want to wait till the end of the year, that's fine. We have already figured out that we can do about 8 of these a month. So we have only so much capacity. But if you wanted to wait till the end of the year to start doing this on October, and we have a way of retaining our services and putting you down on our list of one of the 8 in October that we can help before year end. $67. What you get is my value guarantee, clarity guarantee, and no pressure guarantee. But you also get bonuses. We give you an executive savings blueprint that will show you a 3 to 5 year time horizon. We will give you an employee experience roadmap of what exactly your employees will feel after they've been on the other side. And we will even provide a Revival Health savings calculator that you can use online, that you can plug in any of your situations, no matter what state you're in, no matter how many employees you have. have, what the size of those employees is, you will be able to see right on our savings calculator how much your employees can actually save wherever they live. Everything you need to make an informed decision whether you work with us further or not. Why act now? Well, like I said, I can only take a limited number of new clients each month. When my calendar fills, bookings close. We want to do quality work that focuses on you, and it requires focused attention. I won't compromise that one iota by overextending. Quick ending recap. Can you see why switching brokers hasn't solved this problem? Why you're still in the same system? And why the brokers don't want to sell anything but under the old system? Does employee choice make a little bit more sense now? When they choose, remember, people choose what they create. When they design it and they put their own program together and you redeploy your employer money on top of that, it lowers their cost dramatically or can even wipe it out. Does that make sense? This is simply evidence-based decision making, nothing more than that. I'm not a broker anymore, and I will never ever be a broker again. The last thing I want you to know is that we've put this design program together where there are steps to it. There's design, there's administration, there's enrollment, and there's compliance. But we have found a next level enrollment team that walks every one of your employees through the transition. They are the premier enrollment team in the country. They handle enrollments in all 50 states. They do one-on-one enrollments online. They ask questions. They include the spouse if you need to have the spouse involved in these decisions. And they not only transition you to the other side, but they're there every single year at the end of each year to decide, what do you want to do next year? Whether you've got a single person or a family. They meet with our enrollment team every single year to decide what's best for them in the following year. My advice right now is to stop just hoping for better outcomes. The system that you're in isn't working. It can't work, actually, because it's designed not to work. Consider installing a system that actually serves your business and your employees. Book your discovery session now, and I really look forward to meeting you on the other side. Thanks so much for joining me here today.